Hello and welcome. Today we're diving into a complex and often misunderstood neurological condition, Hashimoto's encephalopathy. This is a rare disorder that links the autoimmune condition, Hashimoto's thyroiditis, to brain dysfunction. We'll explore its causes, symptoms, diagnosis, treatment, and what the future holds for those affected. Hashimoto's encephalopathy, sometimes called steroid-responsive encephalopathy associated with autoimmune thyroiditis, or SHARET, isn't directly caused by the thyroid hormone imbalance itself. Instead, it's believed to be triggered by autoimmune antibodies produced in Hashimoto's thyroiditis that, for reasons not fully understood, cross the blood-brain barrier and target the brain. These antibodies can react with brain tissue, leading to inflammation and neurological symptoms. While a strong association exists with Hashimoto's thyroiditis, the precise trigger for these antibodies to attack the brain remains an active area of research. The pathophysiology of Hashimoto's encephalopathy is complex and still being elucidated. The prevailing theory is that antibodies, such as anti-thyroid peroxidase or anti-thyroglobulin, cross-react with brain antigens. These antibodies might directly bind to neuronal surfaces or enter brain cells, disrupting normal neuronal function. The inflammatory response triggered by these antibodies can lead to neuronal damage, demyelination, and ultimately, neurological dysfunction. Some research suggests that vasculitis, or inflammation of the blood vessels in the brain, may also play a role in some cases, contributing to the brain damage observed in this condition. Hashimoto's encephalopathy is a relatively rare condition, making it difficult to determine its exact prevalence. It's estimated to affect a small percentage of individuals with Hashimoto's thyroiditis, with estimates varying widely. It tends to affect both men and women, often presenting in middle age, although cases have been reported in children and older adults. Due to its rarity and varied symptoms, it can be easily misdiagnosed, likely contributing to an underestimation of its true prevalence. The signs and symptoms of Hashimoto's encephalopathy are highly variable and can fluctuate over time. Common neurological symptoms include cognitive impairment, such as confusion, memory loss, and difficulty concentrating. Seizures are a frequent manifestation. Myoclonus, which are sudden, involuntary muscle jerks, is also commonly seen. Other symptoms can include altered mental status, tremors, hallucinations, psychosis, and sleep disturbances. In some cases, individuals may experience stroke-like episodes or ataxia, which is a lack of muscle coordination. Because the symptoms can be so varied and mimic other neurological conditions, it is important to consider Hashimoto's encephalopathy in the differential diagnosis. Diagnosing Hashimoto's encephalopathy is challenging and often relies on a combination of clinical findings, laboratory tests, and imaging studies. The presence of Hashimoto's thyroiditis is a prerequisite, which is confirmed by elevated levels of anti-thyroid antibodies, anti-TPO and anti-TG in the blood. However, it's important to note that many individuals with Hashimoto's thyroiditis never develop encephalopathy. An EEG, or electroencephalogram, can reveal abnormal brain activity, such as slowing or seizure activity. Brain MRI may show nonspecific findings, such as white matter abnormalities. Cerebrospinal fluid analysis is typically performed to rule out other causes of encephalopathy, such as infection. The diagnosis is often made based on clinical improvement with steroid treatment, which is why the condition is sometimes referred to as steroid-responsive encephalopathy. While Hashimoto's encephalopathy doesn't have rigid classifications or subtypes, it's helpful to distinguish between different clinical presentations. Some individuals experience a more gradual onset of cognitive decline, while others present with more acute and dramatic neurological symptoms, such as seizures or psychosis. The predominant symptoms, cognitive impairment, seizures, or psychiatric manifestations may guide treatment strategies. However, there's no universally accepted classification system for this condition. The primary treatment for Hashimoto's encephalopathy involves immunosuppression, typically with corticosteroids, such as prednisone. High doses of steroids are often required initially to control the inflammation in the brain. If the individual responds well to steroids, the dosage is gradually tapered down over time. In some cases, other immunosuppressant medications, such as azathioprine, methotrexate, or intravenous immunoglobulins of VIG, may be used, especially if the individual does not respond adequately to steroids or requires long-term immunosuppression to prevent relapses. In addition to immunosuppression, supportive care is important to manage individual symptoms, such as psychosis or cognitive impairment. Thyroid hormone replacement is also essential to manage the underlying Hashimoto's thyroiditis. Unfortunately, there's no known way to directly prevent Hashimoto's encephalopathy. Since it's linked to Hashimoto's thyroiditis, managing the thyroid condition with appropriate hormone replacement therapy may potentially reduce the risk, but this has not been definitively proven. early diagnosis and prompt treatment are crucial to minimize brain damage and improve outcomes. The prognosis for Hashimoto's encephalopathy varies depending on the severity of the condition, the timeliness of diagnosis, and the individual's response to treatment. With prompt diagnosis and treatment with steroids, many individuals experience significant improvement in their neurological symptoms. However, some individuals may have residual cognitive deficits or require long-term immunosuppression to prevent relapses. Research is ongoing to identify specific autoantibodies that are directly responsible for the neurological damage, which could lead to more targeted therapies. There's also growing interest in exploring the role of other immunomodulatory therapies and understanding the long-term effects of immunosuppression on individuals with Hashimoto's encephalopathy. Thank you for joining us on this exploration of Hashimoto's encephalopathy. While rare, understanding this condition is critical for accurate diagnosis and effective management.